What about vaccine injury? The ones that actually took the shots, what did you see there?
Massive. I didn't know it was possible for a human to die so horrifically and so quickly before they rolled out the mRNA injections. It was insane. I've never seen anything like that. The worst of them were the ones, they called it sepsis, but it was like instant multi-organ failure. Like within hours, patients would die of liver, lung, kidney, all at once failure, respiratory failure. It was like some of the records, the emergency crew that found them, it's like their body tried to reject everything, and some of these cases, like their family would be there 30 minutes before, and then within an hour they're dead. And then there were patients coming in with seizures like I've never seen before. We couldn't control some of them. Days patients would be seizing, and no medications would stop it, and eventually they kind of had to be put down. They called it encephalitis or encephalopathy, and then later on even the coding information organization AHIMA admitted COVID-19 associated encephalitis. There were blood clots, strokes. The clots were insane. Never seen clots like that before. Even the interventional radiologists that were going in with, they have angiopathies and, different scopes where they can do like heart interventions and put stents in like a carotid artery if you have a stroke going to your brain. Normally it's rare to have more than one stent go in, and they were documenting, multiple locations all at once. They had heart attack cases that were like that, where they needed massive amounts of stents that they never needed before. There were people in their 20s that had been hiking that were totally healthy, had been running marathons, that suddenly needed a leg amputated because they had a massive blood clot going from their hip all the way down to their leg, and it couldn't be saved. So that happened. There were some cases of overnight spinal gangrene, which I've never seen before. And you can't amputate, the spine when it goes gangrenous. Normally they cut out tissue that's dying like that, so it prevents further infection, and they didn't know what to do. The only thing they could do was, basically replace that part of your spine with an implant. That's the best they could do. It was really intense, and I didn't question the vaccines as much as I should have. I started to about the flu shot way back in 2004. But with the pressure to get the COVID-19 shot, I started looking into what it could do, and I knew I didn't want anything to do with this experimental mRNA thing. And when I started looking into the experts that were saying, well, this is what this potential vaccine could do, this is what the research says, I was looking at the vaccine trials and what was happening to those patients, and the Guillain-Barré that was happening, and the strokes that were happening, and so I kind of knew to look for that when the vaccine came out. And the doctors were, baffled. They weren't connecting the dots. But to me, knowing what the potential causes or potential symptoms of a vaccine injury could be, we 100% had all of the things that I just described. But doctors would never tell you that. They would just say it's a stroke, it's a heart attack, it's a blood clot, and they would never connect the two.
Is there anything that would make you take a vaccination of any kind ever again?
They would have to kill me. Nothing would make me take it.